Welcome to our educational video on necrosis. Necrosis is defined as a localized area of death of tissue followed by degradation of tissue by hydrolytic enzymes liberated from dead cells. It is a form of cell death which is accompanied by inflammation. There are 5 types of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis is a type of necrosis where the tissue architecture is preserved for several days after cell death. It is the most common type of necrosis. It is characteristic of infarcts in all solid organs except the brain. The morphological features of coagulative necrosis. Grossly, the affected tissues is pale, firm, and slightly swollen. Microscopically, there is conversion of normal cells into tombstones, which means the outlines of the cells are retained so that the cell type can still be recognized, but their cytoplasmic and nuclear details are lost, which is the hallmark of coagulative necrosis. And the necrosed cells appear swollen and eosinophilic. Liquefactive or coagulative necrosis occurs commonly due to ischemic injury and bacterial or fungal infections. It occurs because microbes stimulate rapid accumulation of inflammatory cells, and the hydrolytic enzymes of leukocytes digest or degrade the tissue, leading to the formation of viscous liquid that is eventually removed by phagocytes. In this type of necrosis, the tissue architecture, cytoplasmic, and nuclear details are lost. Examples are infarct, brain, and abscess cavity. Grossly, the affected area is soft with liquefied center containing necrotic debris with the cyst wall. Microscopically, the cystic space contains a mass of necrotic neutrophils, bacteria, and tissue debris. It is surrounded by cyst wall formed by proliferating capillaries and inflammatory cells. Caseous necrosis is mostly seen in foci of tuberculous infection. It combines features of both coagulative and liquefactive necrosis. Grossly, caseous necrosis resembles dry cheese-like appearance. Microscopically, the necrosed foci are structureless, eosinophilic, and contain granular debris, and the surrounding tissue shows granulomatous inflammatory reaction with epithelioid cells, giant cells, and lymphocytes forming granuloma. Fat necrosis refers to focal areas of fat destruction typically resulting from the release of activated pancreatic lipases into the substance of the pancreas and the peritoneal cavity. It is a unique form of cell death occurring in 2 locations, the pancreas and breast. Fat necrosis breaks down fat into glycerol and fatty acids, which complex with calcium to form calcium soaps, which is called fat saponification. Grossly, fat necrosis appears as yellowish-white or chalky white and firm deposits due to calcium soaps. Microscopically, the necrosed fat cells are cloudy with an inflammatory reaction and surrounded by calcium soaps appear as granular and basophilic deposits. Fibrinoid necrosis is a special form of necrosis, arises in immune reactions and severe hypertension. It is characterized by deposition of fibrin-like material which has the staining properties of fibrin. The deposited immune complexes and plasma proteins and damaged vessels under H and E staining appear bright pink eosinophilic and amorphous resembling fibrin. These are differences between apoptosis and necrosis. In addition to necrosis and apoptosis, there are other pathways of cell death: necroptosis and pyroptosis. Necroptosis is a form of cell death initiated by TNF receptors characterized by features of both necrosis and apoptosis. It is programmed cell death without caspase activation. The mechanism involves activation of receptor-interacting proteins kinases initiating series of events that result in the dissolution of the cell, similar to necrosis. Pyroptosis is a programmed cell death associated with antimicrobial responses during inflammation. It is dependent on caspase activation. This form of cell death is associated with activation of cytosolic danger-sensing protein complex called the inflammasome. Inflammasome activation triggers both apoptosis and cytokine production, leading to inflammation and fever. Autophagy refers to lysosomal digestion of the cell's own components. It is a survival mechanism where cells digest their own components to provide nutrients and energy during nutrient deprivation. The process of autophagy. The intracellular organelles inside a cell are sequestered within an endoplasmic reticulum-derived autophagic vacuole which fuses with lysosomes to form an autophagosome. The lysosomes digest cellular components, aiding cell survival in nutrient-deprived conditions. However, if the cell cannot cope, autophagy may lead to apoptotic cell death. Extensive autophagy is seen in ischemic injury, myopathies, and inflammatory bowel disease. If you found this video helpful, please like, share, and subscribe.